Hi, so hello, good afternoon. Very warm welcome to each one of you. I know that this panel is sitting in between your lunch, but we'll try and make it very interesting. So today we are going to talk about a topic which is at the intersection of innovation, security, and well-being of human beings. That is our cybersecurity revolution and how we are using technology such as AI and big data to further make it secure. As we all know, we are in the middle of a digital health revolution where we're using AI not just for AI-powered diagnostics, but also using AI-driven recommendations in personalized medications. And all this is leading to an exponential opportunity, but at the same time, it is also leading to exponential risk. As we all say and know that health data is not just valuable, it's vulnerable. And data is the new oil, and oil is vulnerable to spillage. So with that context, let me introduce myself. I'm Nisha Bhatia. I'm a director with PwC's Health Industries Practice, and we are by far the leaders in health industries consulting across the health and the pharma value chain. And with me today, joining a very eminent panel from the entire digital health ecosystem, right from the pharma, hospitals, to policymakers and innovators who are sitting here to discuss and debate what is the landscape and what is the future to make a digitally secure, a healthcare system. As we all know, India has made significant strides by introducing ABDM and regulations like DPDP. Also, India is a playground for AI innovations in pharma and hospitals. At the same time, a single breach or a single attack can erode years of progress and the public confidence. So today, the discussion is not just on technology, but also about building trust, resilience, and the future of care. So we have to build a future-ready digital health ecosystem that's safe, secure, adaptable, future-ready, and ethical. So with that, let's lay out the lay of the land. Where do we stand today in terms of our digital health ecosystem? So with that, let me start with you, Pratyush. What do you see? Where do we stand? Government has taken bigger initiatives like ABDM, launching ABDM. At the same time, we also have regulations like DPDP. So first, I would like to understand from you, where do we stand in terms of our digital backbone? How secure it is? What are the gaps that we're seeing today?
Sure.
And then we'll take questions on regulations.
Sure. Thank you so much, Nisha, and thank you so much for setting the context. You're absolutely right. Indian healthcare is undergoing the digital transformation. Now, I'm part of World Economic Forum, and recently we released a report that India can be a global pathfinder in digital health. So there are opportunities, but then there are challenges as well. As you rightly pointed out, ABDM is there, DPDP Act is there. So the government intent is definitely there that we want to go digital. With Viksit Bharat 2047 as an ambition, we cannot think if we are not digital, and we do not have a healthcare ecosystem which is robust, then we cannot achieve these ambition. Now, if talking about the ABDM is, I think, one of the easiest way to achieve some level of security in your organization. It has consent management built in. It has, encryption at rest, encryption in transit. So, and patient is at the center of things. So ABDM is something which I would recommend everybody should be adopting. Now, Indian healthcare, there are different types of entities out there. On one side, we have hospitals which are like big chains, which have financial power, muscle power, and they are innovators. But on the other side, we have hospitals or clinics which are very small. For them, probably cybersecurity is not even at the top of the list. It's not even in their priority. So how do we help them? So ABDM is probably one of the ways in which they can, kind of achieve some level of security. One stat which was very, very disturbing, that Indian healthcare is the, favorite sector for the cyber terrorists, if I may call them, right? So among all the sectors, 8,000 plus attacks, weekly attacks are getting there per organization in the Indian healthcare. So we need to be prepared for that. We need to do certain things to kind of be ready for this. So as WEF, we are also looking at, creating a couple of test bed for innovation in India. We are working with some of the leading names, and what we are trying to do is like we are having security by design. Because one possible data breach will derail everything. India is in transition. Digital health, like there could be different opinions. Like we are probably in early stage of digital health adoption. We are probably, some hospitals are actually way ahead. But one thing is pretty sure, like we are not ready to deal with the attacks. We have to do a lot more. So with that, I'll probably.
No, that's brilliant, brilliantly put, Pratyush. So there are huge gaps which we need to kind of address. At the same time, there has been a lot of regulatory developments in terms of, the Data Protection Act and the new DPDP Act. So I would like to ask very specifically to Manish, if you would like to highlight, what are the imperatives of, complying with DPDP, and also if you could want to highlight the impact of non-compliance.
Yeah, sure. So I think the act is out, and the readiness, a lot of people are moving towards the readiness of it because they're waiting the authority to be established. And yeah, so I think that's but I think in terms of penalty, I think it is ranging to 250 crores. So one should be very cautious in how to fuel the data within the DPDP Act, because everything is resolving around the data, and that's major thing. But I think Pratyush also covered the consent management, which is very important. So the concept of data minimalization, I think that is what everybody has to look at and understand what data we have to keep actually. And with ABDM coming, you'll also have to have interoperability into picture, where you have to have the data of the patient resides with him. The consent of taking the data from him is very important. I think that is what the ABDM is all talking about. And there's a sandbox which is created around it. But while the sandbox is created for the ABDM, it is all the more important to have a framework being formed for the data protection completely. So I think that is what the data fiduciary or significant data fiduciaries are coming in, and the things would revolve around that. And a lot of people should be ready to have the sandbox ready for the applications, how the data is there. It is not the data which is residing with you, it is the data which you also give out to a lot of third parties. I think that is what you need to secure.
No, I mean, the penalty is huge, 250 crores. What do you think? I mean, it's real? Are we seeing this really happening? Are companies paying this out, shelling this out? I think from
so
you and
it is just like a license. You have a driving license and you have a penalty across.
Okay. So going to from you, moving on to Surjit, what would you like to add on this whole DPDP, and what is your experience in seeing the compliance and the impact?
Yeah. So, am I audible? So, so you asked about the penalties. Only the act has been passed. Industry-specific rules are yet to come. So we still don't know. But just to tell you, I mean, we all should understand data security and data privacy. These are two different things.
Brilliant.
Data security can be through technology innovations, through implementation of various processes within. I mean, I represent a hospital, so I can tell you, in hospitals, there can be ways and means through people, process, and technology that you can address the data security. Data privacy is where there's a bigger risk, because that's where legality and ethics come into picture. And I'll give you a very small example. So there was a case in the US wherein a murder was performed and Alexa device was there active, and it went to court, and they had to prove, Alexa proved it, that there was a third person also there. Initially they declined that we don't share, But the challenge was, they said, we don't listen to your conversations at all. And then that's what the federal US judge asked, that if you don't listen, then how do you know when someone says, hey, Alexa? That means you're listening to the entire conversation and taking out the relevant data and posing into the public domain is a far bigger risk. I mean, for example, and this happens to all of us. You talk to your friend or your family and say, I'm planning to buy a new car, and suddenly next day you'll see ads that are coming from, I mean, how is that coming? Now, I mean, it's okay. I mean, they can't do anything beyond, they can't force us to sort of buy the car. But the challenge is when it comes to healthcare, where my personal data is getting compromised, and that is where the challenge is. Hence, the DPDP, I personally look up to DPDP. I'm not talking about the penalties, but those rules have to be there, and the penalty has to be stringent. I mean, just because one guy of 140 crore and his data goes, I mean, for me, it is the entire world. I'm not okay with that. Hence, those penalties have to be there. Government is coming with a lot of initiatives. ABDM, all these are technology innovations. You share the data. But once the sharing of data, there's a bigger risk of data theft as well. There's a global body called Cloud SEK. They do how many breaches happen. And we are at number 2. We Indians are at number 2 in those breaches. And there's absolutely nothing that we should be proud of.
Oh, that's seriously alarming.
And after US, yeah. And India, it's still a taboo. In hospitals or any industry, if a theft happens or a cybercrime happens, we don't go and report. AIMS was reported because it was a public hospital. Private hospital don't report because it's a risk to their reputation. And last thing that I'll want to add here is, I mean, it's not about technology alone. The major theft actually happens from people. And that is where DPDP penalizes the institution, but I think there has to be something for individuals also. And we have to make the rules which are stringent so that people abide by it.
Absolutely. So Joshua, you've just joined. So would you like to add on to what are the current challenges that you're seeing in terms of hospitals where the possible data leakages happen, or what's the kind of the digital layout in hospitals and pharma labs that in your experience you've seen could be the source for data leakage?
So when we started this journey of understanding what all kind of challenges the healthcare delivery organization undergoes, globally as well as regionally, the fundamental question, or I would say the break open, which I hear from most of the hospitals is, they don't know what they are using, first of all. They don't know how many devices connected, how many devices is being connected to a bed or to an operating system or to any facility. They don't have any device inventory maintained. Hardly they have some kind of an Excel or independent systems independently managed. This is the fundamental challenge which we see in any hospital facility. First, we need to know what we are using in the hospital facility or healthcare divisions. And the second challenge we face is most of the hospitals have two different kind of assets, right? One is the healthcare device and non-healthcare devices. So the medical device or the healthcare device is fundamentally managed by the biomed engineers. So these biomed engineers possess knowledge of healthcare related technologies, but they don't have the cross skills of understanding what could be the possible security challenges these biomed devices would undergo. So I would say I used to work for a company who used to provide security for aircrafts, right? The flights, right? Like jets and aircrafts. So I've been called upon to create a awareness program for pilots, to teach them basic or creating an awareness to understand what kind of challenge or what kind of security breaches can be possible in an aircraft. We need to have same kind of program for biomed engineers, make them cross skills, understand what kind of challenges can be possible other than the healthcare engineering. Second is, the moment you understand what kind of assets exist in the hospital, you'll easily come to know what kind of exposures these devices can be possible. So these two things are fundamental, which we see as feedback from many healthcare delivery organizations.
So clearly there are huge gaps, in our current landscape. And moving ahead, let's understand the AI, shift our gears to AI, because India is becoming a playground for AI innovation, right from diagnostics to decision making. And we are using AI to make our digital system secure. So let's understand how we're using AI, to bring in the cybersecurity. But before that, I just read a quote somewhere that artificial intelligence is like a teenage romance. Everyone talks about it. Nobody really knows how to do it. And when it finally shows up, it's not what you expected. So with that, let me pose my next question to Mohan Chandran. If you would like to talk about, some of the, threats now, let's understand how these AI models are being used and what are the kind of threats that we are seeing, especially in hospitals, in your area of experience.
Hi. So I may not touch upon the risk on AI. Preliminary, we have to see how it is getting implemented and adopted in the healthcare environment. So wherever you see any healthcare IT conferences, you always hear about AI only. So in reality, what is happening in a healthcare organization is the first thing, whether you use it for cybersecurity or use it for your daily operations. So people chase AI trends that is happening in India currently. So there is no clarity on what has to be done. So my competitor organization has done something great on AI, so I have to adopt it. I'm not even seeing whether the same use case happens to me or something. So people chases AI trends, which is one major thing which we are seeing in the healthcare organizations. Second thing is that AI is not an IT project. That nobody is aware of. AI is a leadership decision which has to be percolated from the leadership to the last grade of employees. So the responsibility equally divides between all the people. So it has to be driven as a leadership decision. It has to be percolated to the respective teams. Third one is that vendor sells dreams, always. It's not a blame or something. It is the real reality. But we have to be aware of what you need. I'll just, I don't know whether I have time. I've just quickly touch upon one point.
Sure, go ahead.
So I'll just tell a small incident kind of thing, maybe reality or not. So it's kind of story kind of thing. So what's the expectation? So one person was a busy professional who was driving back to home. So his wife called him and immediately asked him to get a clock. So he was in between something. So he just thought my wife has asked for a clock. He went to a super big shop in the area and he got a very marvelous clock which was costing high or something, because it was so thing he thought something like that. When he came home, his expectation was that his wife will be so happy that seeing this one. So when he reached home, he asked, what is the purpose of this? So it was just for a kind of gift she had to give to somebody else. So that was the situation over there. So you expect something and literally something else happens. So that is happening in the environment. Same applies to the cybersecurity AIs also. You build a model of AI for security, which can be easily targeted to change your entire plans of your detection or something. People can easily manipulate. That's one thing. Second thing is that you never validate it well. You don't know the worst case scenarios of an AI model when it fails. And other thing is that you should run some no AI test, like you are running an AI program. In between, if it stops, if people are getting noticed on that, you have to be really thinking of that. So many aspects in that, but generally I would like to touch upon all these points. So whenever you plan for an AI model to drive your decisions, you have to be more careful of their data inputs, the result-driven things, and definitely the aspects of its worst case scenario. Basically, you have to be sure of what happens if it fails. So these are the points I just wanted to just touch upon.
Sure, no, thank you so much. Going on to Vilu, if you would like to add something more on your experience in seeing some of the biggest threats in the industry today, and what are the impacts of it, and how do we build something that is secure?
Yeah, sure, Nisha, thank you. First of all, before I jump into more details of this, I just want to continue from where Sujit left off and what he also added. When we are talking about the kind of threats, we are talking about more of insider threats. If I'm looking at it purely from a hospital perspective, I'm from a hospital. I would like to expand a little bit, because when he said that there are two types of problems that we face in terms of security. One is, of course, equipment basis or the digital side, and the other is data side. So when we are talking about data security, we have to also remember that AI everything is now coming to us from a cloud perspective. You are gone are the days when we were having everything in-house. We could secure it the way we wanted. We could build peripheral systems around it and so on. So the very first thing that we should remember when we are going in for AI is not only its use cases or the fulfillment of it, but also from the threat perspective where the applications that wherein AI is used are not in our control. It's not in an individual organization's control. And irrespective of how many consents we take, or irrespective of how much of security we build around it, the data is going to be exposed to a third party who is sitting with it somewhere, and there is nothing that you can do to stop it from going there. If you're using AI tools, if you're using any kind of systems which are having AI technology built into it, that is one. Second is, of course, when we are talking about AI, even if it is really useful to us, how much do we build it or use it or adopt it from a use case perspective? So when we are talking about a use case for AI, how many times do we sit across the table and discuss these are my problems, these are my challenges, now tell me how the AI is going to help us? A lot of vendors, partners come to us with many AI solutions. Commonest, of course, being AI built into chatbots, AI built into patient engagement, which is the most commonly used use cases. But when we are talking about true AI, whether it is in diagnostics or whether it is in administrative areas, how many times do we really see solutions which are really giving us the impact of AI, usefulness of AI, when in our day-to-day operations, in our day-to-day administrations, and so on. In the previous panel, you all must have heard, one of the panelists had told you about how AI is used in an estimate generation, for example. If certain things can really build that impact, and if that is built into your software meaning as a hospital, if I'm using HIMS, I have an HIMS which is completely built around everything that I require. It may be a third party, it may be in-house grown. But do you really see the AI tools being incorporated into that software, which will enable the kind of automation that we need in a secure manner, wherein my data is not really going out? My data is within the control of the organization. So we need to think about it. When we come to the security on the patient side, where we are using these AI tools, if you take the example of patient engagement itself, each and every AI tool is on cloud. Sure. We are actually opening up our data to them in order to interact with that patient.
And
so,
have you seen any kind of attack? What is your experience of?
Yes,
would you
a
like
lot
to
of
share
tools.
any experience of an attack? What is the magnitude of attack? What is this? We are hearing about data poisoning, model inversion.
Again, as I said, if you're
adversarial
talking
attack.
about a threat attack or a ransomware attack, then there are hundreds of ways to secure yourself and you will never get attacked. That is a given. So if you are looking at only pure cybersecurity attacks, then I would say there are ways and means to control these attacks from reaching you in multiple ways by securing your own organization. There are many things you can do in that. You can build your network in such a way that it is secure. You can build your peripheral firewalls in such a way that you are secure. You need not only go for expensive tools to secure yourself. You have to have your policies in place which are defined in such a way. Like, for example, to give you one example of a policy decision or a policy built in your firewall is, from where are these attacks coming? They are coming not from locally in India or, there are two types of attacks basically. One which is for ransomware and money, the other is for data. If you can secure your environment in such a way, even if your core systems are on cloud, how are you connecting to that cloud? Through your internal networks. How are you connecting to your internal systems? You're connecting through your internal networks, either through your own LAN systems, or you are going in for ILLs, which are again possible to secure. So if you are purely focused on threat security, then you have to secure yourself internally. One, through the firewalls and all. Second is, of course, and most important is, make sure that whatever happens, you have enough sufficient levels of backup of all your data for every application that you run in your organization.
So thank you.
That can save
thank you, Vinu. Let's move on and understand a little bit from our other panelists also, just to try and understand what is the kind of attack. Joshua, would you want to share, you were sharing something about one of the cyber attacks that happened and something, and then we'll move on to you, Hemal, on the strategies part of it and creating awareness. So very quickly, if you want to just add to any one incident, for the people to understand, what is the kind of data poisoning or model inversion that we're seeing in a real life scenario.
So I would try to recall what Sar said, he was mentioning, which I can connect with the use case. He was mentioning CloudSeek is doing a research, and they have found out India's number 2 in terms of leakage of data on the onion webs. So I even had an opportunity to discuss with Sasi, the founder of CloudSeek. He was also mentioning the same thing. We need to build up basics strong. That is the most important thing. How many organizations in India are worried about brand reputation? One of the important aspect in industry, which can be easily ruined from the dark web aspect, right? They can steal your intellectual property, put it on the dark web, and make it ready for sale. I can tell you one use case, as Madam requested. I used to work for a company which is based out of Tel Aviv. I used to travel there and meet up with researchers. So one researcher was curious to know, we've been working on non-medical healthcare verticals. I just opened up this topic. Is it possible to breach any hospital? I'm talking about a decade before, not the recent one. He said it is pretty simple. It's not much complicated as IT network, because IT industries or IT networks or IT companies are pretty mature in terms of building cybersecurity when it's come for a healthcare institution. So he opened up his laptop and randomly picked up some data from the Shodan, and he used the data to understand what kind of information available from the dark web, the onion websites. Picked up a PAC server along with the credentials. Pretty easy, they were using very simple credentials to log in into the PAC system. That's why I was talking about this cross-skill, right? The biomed engineers should be created awareness, at least with the password complexity thing. He used simple passwords to log into the PAC system, downloaded an MRI image of a patient, manipulated the image with deepfake images, and uploaded back to the hospital systems. Of course, he reported back to the hospital, stating that it is possible, we breached your hospital, so go ahead and start fixing it. So this is the level of security which we see in the hospital environment.
That's the kind of level of breach that is happening, and that's the
exactly. And I also like to quote one point Madam emphasized, right? Self-assess first. We need to understand what kind of use cases we need to embrace in the healthcare industry. And when it's come for AI, we need to be more cautious. I can call upon one case study which was done by Facebook. So Facebook was using a bot. I think almost 5-6 years before, I remember I studied this case study. So they were using bots to give feeds to their users, like Facebook users, right? Or beneficiaries. It was a control bot, but some point of time, it started learning on its own and not aligning with the protocol which is supposed to be. So AI is good, but if it is running in a controlled manner within the hands of a human, then
Sure.
it makes sense like to start using it.
So Hemal, now to you, I think you've been waiting for long, but then want to understand from you what kind of IT systems are you building, to detect any kind of possible threats or manipulations like the ones that we discussed. And also, I would like you to touch upon what kind of awareness programs do you think that in your experience that you're seeing, which has been built up in a hospital or a pharma company. And lastly, if you also want to touch upon the zero trust architecture, so perhaps you could cover these.
Sure. Thank you very much, Nisha. And I think a lot of inputs and insights from my co-panelists here. I think the most important thing, if you look at data security, data privacy, is about where your data resides and who has access to it, right? And having awareness of that, right? As we have different kinds of devices in our environment, be it within our premises, be it on the cloud, be it on the periphery and so on. Similarly, we also have different kinds of user personas who are accessing that information, right? So it's very important to hence, have an inventory or a profiling of who is accessing what information, where is this information residing, and by doing that, you'll be able to understand where your vulnerabilities lie. Awareness is all about knowing where the vulnerabilities are, and only then you'll be able to build up a plan and systems to protect them, right? With all these policies coming in place, it is becoming very critical for us to ensure that our data, access to our data is as minimal as possible to ensure that there is no leakage. Now, obviously, it cannot be 100% foolproof, but then you have technologies like zero trust, which basically means that don't trust any time any access is being done to our data, right? The access could be coming from wherever, but every time, you recheck, double check, it's coming from persona or profile which is supposed to be having access to it. So you have, solutions around zero trust, which actually ensure that wherever your data is being accessed, be it from your own controlled networks, be it from your homes, from hotels, from airports, etc. We access data from everywhere, right? It is coming through a trusted, the person is trusted enough to be given access to it. The second most important thing is, about creating awareness within the user community, the people who are accessing the data, right? How we can make them aware or trained to identify, situations where there is an anomaly. Right? Many times we believe that there is something wrong, but we kind of say must be something, and we just take it lightly. And with the prevalence of AI and that increasing, we are leaving too many things to automation without having control can be very, very dangerous. And we hear about AI solutions coming for security monitoring and helping us becoming more proactive, better response times, getting into closed loop systems, isolating systems, and so on. But there's a very good possibility that AI solution itself could be injected with or poisoned in a way that it can mislead the entire process, right? And hence, if you let it go uncontrolled or unmonitored, you are inviting more trouble by putting an AI solution which was supposed to help you in the first place. And just to give you a very quick example, right, may not be relevant to pharma or our hospitals, but there's a very good example which recently we would have read in the news that one of our planes which was going for a rehabilitation support to Myanmar earthquake, it was actually it got confused by the GPS signals which was spoofed, and it was leading into wrong direction. Now, with all the advancements we have in technologies today, these things are also a great concern. Now, imagine something like that happening to your data, to your AI models, which is supposed to, predict, your patient outcomes. It's supposed to predict, your processes, control your equipments. That gets poisoned, and you have no oversight. The damages are going to be far more. And by the time you come to know about it, I think it will be too late. So, building that awareness of people who are using data, regular training, regular simulations, regular, role plays, etc., is very, very critical.
No, thank you so much. And Surajit, should I bring you back in to understand, how do we bring in a balance of cybersecurity with operational efficiency and patient care? How do we bring the patient right back into center, not just the data giver, but the data owner?
Yeah. So, healthcare is something that two people will remain in the center. One is the doctors, other is the patient. Everything is the entire paraphernalia around it, whether it is the IoT devices, IoMT devices, or technology, or we call IT as a strategy function, support function, or whatever. So everything would be around that. So what needs to happen in this is there has to be a balance between what we want to automate and what technology. I'll just give you an example of this as well. So one of the most vulnerable where cyber threats do happen is through medical devices, because those have been built in a very rudimentary technologies, stable but rudimentary technologies. But the moment technology is rudimentary, everything around it is progressing, and that's where the threats do happen. So, and one of the things that JCI, we all know JCI is the accreditation body. JCI has introduced cybersecurity and AI in the latest edition, effective from 1st of January 2025. Now the challenge is, and the moment they have done this, all the medical equipment which actually interacts and actually there is a data movement that happens with those get vulnerable and comes in this ambit. So one of the things that we are actually doing in our hospital is we are bringing the entire biomedical department itself in under IT, because all these devices, more devices that we are trying to connect onto or bring onto the patient platform, the vulnerability increases. So that's one thing that we are trying to do at our hospital. Second thing, you also spoke about the breaches. So just to give you the magnitude, 2022 last quarter, AIIMS was hacked. And we all know public hospital, what is the level of automation? So they were only doing appointments. They were only doing lab automation where results used to come. And the entire system was down for 2 weeks post cyber attack. Down means down. Nothing was operational for 2 weeks. For radiology online appointment to get functional, it took AIIMS 6 months to get operational. So that is what the challenge is. Once it happens, then you can only repent, you can put things around it. So, but having said, we spoke in this forum and also the previous forum where that patient engagement is one thing. Ultimately, patient has to pay, whether through cash or through insurance. Ultimately, payment has to come from them. But we have to do engagement activities to attract them. We have to give them tools so that they can download their prescriptions online, they can do orders online, they can view the lab reports, discharge summary, so on and so forth. More engagements that we do, and that is where more vulnerable we become. And that is where we spoke about technology, zero trust networks. We spoke about the medical devices and the upgradation around it. And of course, people. Sure. In JCIA, there is a word which we follow in our hospital, is mumps is the word. You're not supposed to speak anything which is relevant for the patient. No data at all, because that's also data.
Sure, and that comes with a lot of awareness program that is being carried out.
Yeah.
So I think, Manish, you spoke about the sandbox, to encourage innovation. Do you think there is a need for national health cybersecurity policy going forward and, to further encourage innovation at the same time, bring in more security?
Absolutely. So I think with a lot of standards across, we have an NIST cyber framework which is around. So we should be. There is an ideology change that has to be. It has to come, because
Sure.
See a scenario where there is a war, and we have seen our key speaker saying 68% of our devices are imported,
Sure.
and we have a war with a partner country who controls all these devices. So take an example of a pacemaker which is fitted in you, and there's a war which happens. What you think there is there. So there is, I think, as a policy making, our country has to have a wake up call and
Sure.
have to have all the policy makers around, make sure that they are making people very, very sensitive for what has to be adopted.
Yeah.
So like we
Yeah.
got in for AIMS, there was
Sure.
no appointment to be booked. So it's a denial of services attack, which is an old cyber security so if you are denied of a services which is required for a security,
Sure.
for patient safety, it is very important to have a framework around.
Sure, sure. So I think now we are just going to wrap it up, and let's zoom out and understand how do we build secure AI-powered healthcare. Because a secure-powered healthcare cannot be built in silos, and we need to collaborate. So, I would like to understand from you, Pratyush, and then from you, Mohan, how do we go from here and understand, what kind of public-private partnerships can be looked at?
Yeah, so first of all, this problem is complex. This problem is global. And if this problem comes in, it impacts both public sector and private sector, right?
Absolutely,
Equally.
yeah.
So the collaboration is the way forward.
True.
As World Economic Forum, we have seen that public-private collaborations have actually helped solve complex problems, have actually helped initiate the dialogues and understand, the success stories, the learnings
Sure.
properly. Both public sector and private sector have their own strengths. Public sector, when it comes to India, there's a huge segment of people who only goes to the public sector, right? There is, the private sector has innovation capabilities. They have the financial muscle, so they can bring in the innovative solutions. But the public sector can bring in the regulation. They can bring in the policy. They can bring in the mandate, right? So it's a matter of collaboration. The dialogues are required, and this is the way forward.
Absolutely. What is missing and what really could accelerate AI adoption in the industry today?
Basically, cybersecurity is everyone's responsibility. That awareness has to be built, even in your personal life or in your professional life. Everyone has to be responsible for cybersecurity. So in healthcare aspects, especially as everybody talked, if each of the person working in each of the environment, if he is aware of what is cybersecurity, 80% of the things can get resolved. Instead of building high-end networks and other things, still you have a risk of cybersecurity challenges. So awareness is the first part that has to be done. And when you run through the digital transformations, that became the priority post-COVID. So cybersecurity was never a priority at that time because you had to cater to the people on a crisis mode. So everybody built in lot of applications post-COVID to cater to the healthcare fraternity, wherein cybersecurity was not a priority at that time. And once the systems were set up, then the attacks also has been increased, and then only people came to know that this has to be a priority. So we are able to build up systems to cater to all these challenges, but still there are loopholes which has to be mitigated through multiple ways. One can be cyber security awareness. One can be building good systems across. But that also we don't know up to what extent. Whatever good systems you build, the people are bringing up with new technologies to hack that. So obviously there is a challenge, but we have to work together to close that on priority. Thank you.
No, absolutely. So cybersecurity is no longer just an IT checklist, is what you
Never,
said.
never.
It's a clinical, ethical, and a public
Yes,
trust
yes, yes,
imperative.
yes.
So with that, we are coming to end of this session. And as we all heard that, we have made huge strides in the cybersecurity revolution. That was the topic. And we are at the edge of a transformation. As we all understand, the building blocks are here, but we have to move ahead with urgency, clarity, and collaboration. So with that, let's build an AI system that just doesn't heal faster, but it also heals securely. So with that, I open for any questions, 1 or 2 questions. I know we are just waiting for the lunch, but if we have any questions from the audience, or, we can just end with that.
Ma'am, I request we take questions during the lunch.
Okay, so then we can have one-to-one question answer sessions. So thank you so much, each and every one of you and our fellow panelists. Thank you so much for bringing such a diverse experience and perspective. Thank you once again. So let's be a part of this revolution and make it more secure. Thank you so much.